This is Rayana. This is Lynette's older sister. Rayana is 6. She obviously has the same genetic disorder as Lynette does. She is a little bit worse than Lynette is, just due to age and the fact that she's obviously had this much longer. She is also very floppy. You can see she does a lot of mouth breathing. She's had a lot of pneumonia this last year. Her hips are out of their sockets, which is why she sits kind of in this V position. So don't try to force them into any other position. This is what's most comfortable for her. It causes her a lot of pain if you try to push her legs together. Also, her feet, you can see, she has that internal rotation on her feet. So one of the things you can do with her is when she's lying down, and again she needs to lie on a wedge with her head up, just to help. She's quite heavy, so if 2 of you need to carry her, that's fine. The easiest way to carry her is just put your hand between her legs and give her support here, and then of course give her head support and neck support. And you lay her down. You can work on flexing her ankles, okay? So push them out so that they're in a neutral position, and you can see she has that reaction because she's very tight. So she's trying to pull away, and you're bending, going up. Okay? So just putting it in a neutral position, and then bending it up. And her knees will bend as you go through. Same thing with this side. She can no longer wear her AFOs because of the positioning that her feet stay in most of the time. So just do the best you can as far as getting them in a neutral position and stretching them. Rubbing, because she can't see, because she can't swallow, she's missing 2 of her senses. Listening for her is important, so music is wonderful for her. The other thing, again, is just doing gentle massage. She doesn't have contractures in her hands or her arms, but she also doesn't have muscle control. So just gently massaging her. You can use a little bit of lotion if you want. Starting at the hands, working the way up to the shoulders. Same thing that we do with Lynette and Juliana and Dolly, who you'll meet a little bit later. So that's very important for her. Another thing you can do with her is the Tias will put her in her chair, her wheelchair, and then the wheelchair can be brought outside and just have her sit out there, listen to some music. She loves to have the wind in her hair. Anything that will stimulate her to be more part of her environment. And of course, having her sit up is important. So if you are just talking with somebody, just having her sit on your lap. You need a couple of hands to do this because she's very floppy. Just have her sit with her back towards you, with her some support here. Just being in that position will help loosen up a lot of that phlegm. So keep a bib handy or keep a diaper handy. And she should have, again, about 30-45 minutes a day of stimulation and sitting up.